Hello and welcome to this video about oxygen therapy. My name is Mike Hess and I'm a respiratory therapist with the COPD Foundation. I'm joined today by Susan Jacobs, a registered nurse with the American Thoracic Society and longtime advocate on behalf of people who use oxygen therapy. Susan, thank you for joining us today.
Oh, you're welcome, Mike. It's a great pleasure to be here.
All right, so let's jump into our first topic here. So can you tell us a little bit about the condition known as interstitial lung disease?
Yes, interstitial lung disease really refers to a very broad group of almost over 200 lung conditions, and they all share the common problem of having damage to the wall around the air sac. That is where kind of the action is in the lung. That's where the oxygen enters the lung and then crosses through that air sac into the bloodstream. So that area, that wall, is actually called the interstitium. So these group of diseases have damaged that wall, sometimes with just being inflamed or swollen, but many times it goes on to form scar tissue around that air sac. And the case where the air sacs are scarred, we really refer to that as pulmonary fibrosis. So pulmonary fibrosis we see as kind of a subset of the interstitial lung disease group. We tend to divide the category of interstitial lung disease into maybe three main buckets, if you will. One group of these patients may have damage because of something they were exposed to. Either they inhaled it, they might have had some radiation to the chest. Some medications can cause this type of an inflammatory and scarring response. So that's exposure related. The second group of people that fall under this interstitial lung disease broad category are those that have autoimmune disease. And this could be something like scleroderma. Some rheumatoid arthritis patients can have an inflammatory response that actually affects the lung. So there are a large group of patients that have inflammatory changes and then sometimes scarring because of an autoimmune condition. And then the third large group are those patients who we don't find a cause. We can't identify an exposure. We've tested them for autoimmune disease and it's negative. And they have some classic findings on the CT scan. And we call this group idiopathic, meaning no known cause. So those are kind of the three broad categories. And this scarring around the air sacs can make the lung stiffer, and it can show up on the CT scan as looks like thickened scar tissue. So that's a way we can see it. There's probably about 250,000 patients in the US with some type of interstitial lung disease. And we think there are about 50,000 patients that get diagnosed newly each year.